Okay, so when we start talking about peripheral nerve entrapments and the different types, one of the first areas we're going to talk about, especially for cubital tunnel syndrome, and also not only for radial tunnel syndrome, but in terms of radial nerve entrapments as well, like radial tunnel syndrome. There are a couple of sites here that over the years that I tend to see are a quite common stream. The tricep is one of these muscles. So we have the radial nerve that actually comes around here, and it's at this portion in the back here that we see a lot of entrapment. If we look here also on the inside of the tricep, the medial head, we find a lot of entrapment sites in through here as well for the cubital tunnel. Okay, so if we're talking about radial nerve, we're going to look at the bulk and the big part of the tricep through here where the nerve actually comes around, okay, where we've got that what we call a spiral groove, and then obviously this section here where we also get, as far as I'm concerned, especially for cubital tunnel syndrome, this is probably the most prominent area of entrapment. Okay, we have the ulnar nerve that ducts down here, and then that comes underneath the flexor carpi ulnaris muscle. Okay, but we're actually talking about the entrapment sites here. So let's look at a few techniques to help free up these areas here. So once again, it's all about engaging the tissue. You need to have the triceps supported like so. I'm going to pick up, I like to place my hand underneath so I've got full control over the tricep itself, and then we'll use this as this is going to be our treatment hand. So if we're talking about the spiral groove and we're talking about the radial nerve coming around here, then the idea is that we can then start to work along this area here. Okay, so we're going to use a bit of a broad base, loose fist type technique here. So we're going to gather all the tissue I can from the lateral over to the medial, lock it down through there, and then I'm going to work along the length of the tricep itself. Okay, so I'm not trying to push down, I'm actually looking at gliding along the length of the tricep itself like so. Okay, so there's going to be two parts to this technique. So once along here, okay, like so, lock down and along. Like so. And the second part will be as I swap hands, this hand will come down here, and then I can lock in with a forearm. So we're just going to lock, same scenario, bring the tissue over, medial, and then work along the length of that tricep. Now we've got a couple of trigger points in the tricep itself. We're not, once again, we are sort of focused on some of them, so we can stop and work a little bit on those, wait for them to slowly subside. But this technique is all about the speed, so we slow it right down and work as purposeful and as we can. We're not too much pressure onto the humerus at all. If you are, then you're going too deep and too hard, okay? So you need to lighten your load off, okay? So once again, bringing tissue across, like so. You've got two trigger points, one either side through here around the elbow, so we can work along through those and along the length of that tricep round where the spiral groove is itself. Okay, now your clients may get a little bit of pins and needle tingling and so forth, especially into the sort of almost the pointer. If that's the case, the pointer finger and the thumb, then we know we're in the right area as well. Okay, so that's the radial nerve coming around here. The second one is we're going to be looking at the medial head of the tricep, which is around through here. So this is really important. We don't want to be working on the ulnar nerve here, okay, because that's definitely not what we want. We've got that little groove there that your ulnar nerve sits in. That's what we classify as our funny bone. God forbid you hit that. Okay, it sends a tingle down your arm. All right, so we want to stay away from that, but it is this portion of the tricep that we want to come in and work. So in regards to doing this, we are then going to drag the tissue away from the medial, like so. And then we're going to lock down through here and just work really purposeful along this section. If you're over here, then you're actually going to run along the ulnar nerve, and then you'll distribute a lot of pain and paresthesia down there, so you're on the wrong side. Okay, so you're going to come in this way and lock down. Okay, you don't need a huge amount of pressure. You can basically see my elbow's locked out, wrist is in neutral, and then I'm just working along literally with that part of my pointer finger. like so. So this is just a really small stroke, like so, back again, and along the length of that medial head of the tricep. Okay, staying away from the actual ulnar nerve itself. All right, so that's the 2 points in tricep: spiral groove and the medial head of the tricep for the ulnar nerve.